my beauties. My name is Dr. Stefani Kappel and I'm a board-certified fellowship-trained cosmetic dermatologist in Newport Beach, California. And today I'm going to be a review on new technologies and new innovations in the field of cosmetic dermatology, laser medicine, and aesthetics. So taking away information that I just gained from attending this amazing conference called Masters of Aesthetics. It's an annual conference that happens, and it's like a meeting of the minds, if you will. It happened in San Diego just this last weekend, so I wanted to film this video while the information is fresh in my mind and before many of these things start popping up all over the place, and you guys can hear it here first and understand what a lot of these new innovative technologies and devices and lasers and all the new products that are coming out within the next like 1 to 3 years in cosmetic dermatology. So I just finished my clinic. I'm here in my office and just wanted to do this video to just kind of recap all the different things that I learned. And I may cover it all in this video, but I may have subsequent videos that come after this if I forget anything or if I just don't have enough time to cover everything today. So before I move on, I ask that you like and subscribe and share this channel with anyone who may find it useful, anyone who loves skin science as much as we do, and anyone who wants to be kept on the forefront of technology from a reputable source backed by 20 years of education in cosmetic dermatology and lasers. And I've been in practice over 15 years now. So I love giving unsponsored, unbiased information, real products that I really recommend for my patients, and I don't take any paid sponsorships. I never have and I never will, because I love the autonomy to really just recommend what I truly feel is best. And if something better comes along or some new innovation comes along, I test it, I research it, and if it's definitely something that I would recommend for my patients, I recommend it to you guys. And if I don't, it's usually because it's maybe not the best, or it's a lot of hype, or I won't allow anybody to pay me to say anything that I don't want to say, which is why I don't accept any paid partnerships or sponsorships. So everything is fully just truth and honesty, backed by anecdotal data, clinical trials, and my colleagues kind of giving us feedback at these different academic meetings as to what's good, what's new, what's worth it, what's not. Well, probably not what's not, because I only talk about the good ones. I don't really want to say anything negative about things that I don't feel work or show much promise in the future. So just like and subscribe and hit the notification bell, because I'll drop new dermatology information every Sunday morning. So one of the coolest things that I took away from this amazing meeting was that I feel that the focus is now going more back to the skin, where of course I feel like it should have never left, but I feel like concentrating on the skin quality, skin health, skin texture is everything. I feel like we have entered and hopefully exited an epidemic where fillers were kind of the at-all be-all. Medi spas were just giving a ton of people a ton of fillers and just trying to, eliminate fine lines and wrinkles and volume loss by doing a bunch of fillers. And then people started looking crazy for a little while. And now we're kind of like bringing it back home and redirecting everyone on the right path. So although I do a ton of fillers in my office, I just did it all morning and all afternoon just now, but fillers aren't the only answer to rejuvenation and prejuvenation. It's lasers and tightening devices and skincare and photo protection and a little bit of filler here and there. Yes, it definitely has its role, but there's so many different tools in our armamentarium and our toolbox that we can't just rely on filler like we have been in the decades past. And now the fillers are now 20 years old. Now we're seeing that they're sticking around a little bit longer than we anticipated them to. Plastic surgeons are saying sometimes it gets in the way of surgery and whatnot. So like with everything in moderation. And I always feel like fillers are, a piece of gym equipment in the gym when you're working out. You don't just do the weights. You do a little bit of weights, you do a little bit of machines, you do a little cardio, you do a little resistance band, you eat clean, which is like your skincare that you do when you go home. And it just gives a very well-balanced, very global approach to aesthetics, or, working out your overall physique and, your body contour. So I feel that, now that after attending this meeting, there was a lot of innovation going into new lasers and new devices and combining laser treatments, and even like chemical peels. We heard a lot about chemical peels at this conference, and I think it's because we're moving more towards skin health and the texture of the skin, which I feel is so important, and I couldn't agree more with. And I've been a laser girl all along, because I know that there's nothing really that can touch the results of a laser. You could talk about microneedling or microneedling with or without RF, but unless you have a laser surgeon who specifically knows what lasers to use, Dr. Vic Ross, who's a well-renowned laser laser specialist said, think like a dermatopathologist. When we see the skin as dermatologists, we have to see not only at the surface level of the skin, but look under the microscope. What does that skin look like? Where is that melanin? Is it deep? Is it superficial? Are there blood vessels? Are there a lot of sebaceous glands? And just target your laser therapy to target different aspects of whatever this major skin problem is for your patients, and just combining different laser therapies and different biostimulatory effects to regenerate your skin from within on a cellular level is always best. So the focus was a lot about lasers and stimulating skin health, and I think that's also important in a world where a lot of people may sometimes have before just relied on plastic surgery. Like they thrash their skin and they're like, okay, well, when I'm in my 60s, I'll just have a neck lift and like a facelift and everything will be fine. Well, it won't be fine because surgery doesn't correct skin texture and skin blemishes and damaged skin. You have to do that through lasers or devices and at-home skincare products, photoprotecting with the right photoprotecting agents. And I feel that, just doing a little, suturing and cutting and resuturing isn't you can't surgery your way into having healthy skin, and that's everything. So that was kind of the big take-home message of the meeting. And then hearing about different new innovative products and devices coming down the pipeline was really, really fun too. Also, being at this meeting, it was basically all world-renowned experts, fellowship-trained cosmetic dermatologists, and the people who have trained us, generations that came before us, generations that came after us. But what we all had in common is we all speak the same language, because it is just a higher caliber of cosmetic dermatologists and higher level of training where we can talk to each other in real life, real term results in a way that's not over anyone's head or that we have to hold back in any way. So it was a really beautiful conference and just such a conference among experts. And I literally tried to live stream when I was in the conference, because you guys are my people, you're my family, you're my skin family, and I just love taking you with me. Just like when I was in medical school, I used to try to sneak my phone into lectures and post on Instagram stories when I had a new laser in the office, or my mentor got a new laser, we were doing a new clinical trial, but I also get in trouble sometimes when I do that. So I have to be careful. So as much as I wanted to keep you guys in my pocket like I do in clinic, and I just snap my little BTS, clinical treatments that I'm doing in the office, I wish I could have brought you guys in the lecture with me, but I can't, and I didn't. So, and I also wanted to be respectful to my mentors and my colleagues and other people who were attending the meeting, but I did write kind of a list of things that I wanted to share with you. And I did a live on my YouTube channel after the meeting to kind of recap, but here's just another recap, kind of diving in a little bit deeper. So there was a lot of talk, and Dr. Vic Ross, who's a very well-established laser specialist, he's also in San Diego, was talking about moving more from solid-state lasers to fiber lasers. So a laser that was getting a lot of talk was the Ultra Clear. So Ultra Clear is a laser, and it's a fiber laser using the cold fiber technology. And what it is there's no downtime, and speaking to my colleagues and hearing these lectures, there really isn't much numbing needed because the discomfort isn't that bad. And it's better for younger patients who want a little bit more prejuvenation. So I kind of would think of it along the same lines as the Clear and Brilliant. So Clear and Brilliant is a very light resurfacing fractionated laser. It's kind of like a baby Fraxel, but there's little to no downtime and little to no aftercare. And usually you need a couple treatments to equal the results of something bigger like a non-ablative Fraxel Restore. But it's better for patients who don't have the downtime, don't really want to feel anything. There is numbing that is needed for Clear and Brilliant, and without the numbing, it can be a little spicy. But supposedly with Ultra Clear, and speaking to some of my colleagues and getting information hot off the press, it's a new fiber laser that's good for evening out pigmentation, even acne scars, improving texture and pigmentation with little to no downtime. But also the added benefit, which Clear and Brilliant doesn't have, is that you can do it without numbing. Now this is what was being said at the lectures, and this is anecdotal evidence, but I guess I would have to see the laser and play with it myself to say if you truly can have this laser treatment without numbing. But that would be an advantage to it over Clear and Brilliant, because although Clear and Brilliant is not painful with numbing, without numbing it can be a little spicy. So supposedly the Ultra Clear is a laser that doesn't require numbing, and there's no pain or downtime without numbing cream, which makes it pretty cool. So I'm excited to hear a little bit more about Ultra Clear. So another topic that was discussed is the movement to fully ablative lasers. So ablative lasers are different than non-ablative lasers in that they use the photons and the coherent light of a laser to remove tissue and vaporize it instead of just heating it up. So an ablative laser takes out pieces of skin using light, photons, versus non-ablative just heats it up. So you're not pinpoint bleeding, you're a little bit red and swollen after a non-ablative laser, but unlike an ablative laser, which would be more like a CO2 or an erbium, the skin's not removed so you don't have the pinpoint bleeding afterwards. Fully ablative lasers are not fractionated, meaning they don't take fractions or pieces of the skin out. They take the whole top layer, parts of the epidermis off the skin. The results are amazing, and although I do love ablative lasers and I use a ton of them in my fellowship, I don't use ablative lasers as much in my office today. I just opened my practice 3 years ago. I'm in Newport Beach, California. A lot of my patients don't have the downtime, don't want to have to put in the aftercare, and they don't have as much photo damage and skin damage because they're on their skincare game. They use, high grade, medical grade skincare products. They photo protect starting at a very early age. Don't, have really like the downtime or the need for fully ablative lasers or fractionated ablative lasers. So I don't happen to have that device in my office. In my fellowship, where I trained in Northern California, where we had a little bit older patient population with fair skin, it was next to UC Davis, where there was a lot of people who were like farmers and out in the sun and in the farming industry. So there was a lot of photo damage, and we would have to use a lot of ablative lasers to kind of resurface the skin, decrease the incidence of skin cancer and precancerous lesions. But these patients would be pretty beat up. We would need a lot of anesthetic. We'd have to do numbing cream, Toradol shots, nerve blocks. Now they use, nitrous gas or Pronox to help with pain and discomfort. But when I opened my office, I didn't think that fit my patient population as well. So that's why I don't have an ablative laser. However, I'm thinking about probably incorporating one into my office just because I see the need for it now. And now that we're getting more focused on the skin and trying to get away more from like fillers and more fillers, and trying to kind of, redirect so surgery isn't as needed as often as it has been in the past. I feel like ablative laser, I agree, are going to be making a comeback, especially fully ablative lasers, not fractionated ablative lasers. Those will too, but I think fully ablative lasers will come back after they've kind of been out of vogue for a while. So that was interesting. So the next topic that I thought was interesting was RF microneedling. If the microneedling tips are coated and they go past the DEJ, or the dermal epidermal junction, there can be injury to the melanocytes. So this is really important because that's why I don't have a microneedling device. Well, first of all, compared to lasers, I don't think microneedling holds a candle to lasers. But for people who don't have access to lasers, I think microneedling could be a viable or a good option. However, the risk of post-inflammatory hyperpigmentation, I don't feel, in my professional opinion, is worth the risk, because I see a lot of post-inflammatory hyperpigmentation from microneedling. And to be honest, I feel like microneedling results are always underwhelming when compared to like a Fraxel or a Halo or a laser or a CO2. I mean, there's just no comparison. However, most people aren't comparing microneedling to lasers, because usually lasers, I feel, have the best outcomes. But when compared to, a facial or like a hydrofacial or, a lower level treatment, of course, microneedling will be better. However, I feel the risk and the caveat of hyperpigmentation or even possible scarring doesn't outweigh the benefit of the procedure. So I haven't to date been a big microneedling fan, and that's why. A lot of my colleagues like it, and if they like it, and if you happen to have had microneedling and you're a fan, I'm all for it. we're all a product of our experiences, and when you're in a clinic, you're seeing other people's complications, you have to treat them. It kind of turns you off from the device. But on that note, microcoring is a different technology, and one of the new technologies that's going to be coming out soon. It's called Ellacor, and I'll probably do a whole other video just on Ellacor, what it entails, what it does, and what it means. When microneedling first came out, I was super excited about it, and I couldn't get my hands on it fast enough, and I did a whole Good Day LA segment on it. I was on the news talking about it, and it was like the thing. But after going through several different platforms, Profound and Vivace, and I'm being honest, again, I'm not sponsored, so I can tell you guys how it is and talk straight to you. A Vivace, a Profound, an Infinite, Morpheus 8, I've just always not been very impressed by those results. So, you have high hopes for something, and then sometimes when you actually get it in your office and you use it on patients and it's not performing how you thought it was, it's okay to say, okay, I'm not a fan of it, let's see the next thing that comes along. So Ellacor is a microcoring device, and I very well may say the same thing about Ellacor. Again, I speak the truth to you, I'm honest, but I'm very excited about Ellacor, although I have been excited about other procedures that don't end up, performing as I expected, but I really do have high hopes for this because I participated in the clinical trials and it was amazing back then. They've integrated the technology and made it even better, and for the first time this last weekend I got to actually hold one and play with one. And basically what microcoring is it takes thousands of little punch biopsies or skin excisions in a scarless fashion. The downtime is only 1 week. The post-treatment healing is not bad at all, and it basically is a non-surgical facelift, like for real, because you're excising all that skin. Now you're not moving around muscle and fascia and fat like you do in a facelift, but you're excising the skin that you would have removed in a facelift, minus those terrible scars that people have like in the hairline and in front of the ears. And it's basically taking multiple little skin biopsies or skin punches out. You're removing skin in this scarless fashion, but at the end of the day you're taking out as much skin as you would have if you were to cut sections of it out and pull and lift and tuck it up. So I'm really excited because during the clinical trials, I did it a lot for like lip lines around the mouth and just for all over, you know, facial, lower face, for tightening, and I was really impressed back then. And so I'm very hopeful and excited for it to become available. And the colleagues of mine my colleagues who have used it so far, you know, at Mass General and, you know, at Harvard and in San Diego and in Connecticut, like world-renowned experts who I got to talk to during this meeting last week, and were like, yeah, Steph, you need to get this device. It's amazing. Look at the before and afters. And these are real before and afters coming from real esteemed colleagues of mine who are laser experts and fellowship trained, who I really respect and admire. And when they tell me something works or they're happy with it or their patients are happy with it, that means everything to me. So I'm excited. Hopefully I'll have more information on Ellacor, but that was another hot topic that was discussed at the meeting. So the next new device, now this isn't technically new, but for us, you know, it's new, but my colleagues who participated in clinical trials and have been using this for 6 to 12 months, this is information coming from them. And a cellulite treatment called Aveli, I'm probably pronouncing it wrong. I don't know if it's Aveli or Aveli. It's targeted verifiable subcision. So Dr. Jeremy Green and a lot of other my well-esteemed colleagues in cosmetic dermatology, we were saying great things about this device. And it's basically a great cellulite treatment. And what they said was, it's kind of like Cellfina. I used to have a Cellfina, and I actually participated in the clinical trials for Cellfina, and it worked really great. And it basically helped cut the tethering bands, the fibroconnective tissue bands that take the skin and tether it down to the underlying surfaces, which was what causes that dimpled cellulite. When you release those bands, the skin floats up and the smooth contour of the cellulite, or the dimpled contour of the cellulite, smooths out. So it looks a lot nicer on the buttocks and the posterior thighs are the areas that we used it the most. Now, Cellfina was difficult because the setup and the subcision device with suction kind of made it a little bit harder for the provider and for the patient. It was a very big, you know, setup process for the procedure for the treatment. And so I feel like Aveli, which is basically targeted verifiable subcision, there's a guiding light and a certain type of, it was like a cannula or a probe for subcision that gave very precise lysis of these adhesions, which tethered the dimpled cellulite down for a beautiful contour. And so one colleague of mine literally like flew in from Florida, gave this amazing talk, and he hopped on a plane and he like flew right back. And it was just so meaningful to hear him just drop these pearls of wisdom, showing his actual before and afters in him and his office videos of him performing this procedure. So I think that that's going to have a lot of promise. And if you guys hear about it, Aveli, that's what it is. And I think it's probably going to replace, it definitely is going to replace Cellfina, and it's probably going to replace Quo also. I heard some of my colleagues are having, again, I could speak like this because I'm not tied into any companies, and a lot of people have said that Quo sometimes will give some, you know, hyperpigmentation or some hemosiderin deposition, which is really hard to treat. So like the bruising and the kind of aftermath of the pigmentary alteration of the skin after Quo has been a little bit problematic. So maybe looking into this new treatment would show a little bit more promise. And again, I want to close with, up to this point in my career, I've always been afraid of saying something or not saying something or hurting someone's feelings or not hurting someone's feelings. And when I say someone, I mean like a company. But the thing is that I'm realizing that I am a little bit of a rarity and that I don't do paid sponsorships and I don't have really ties with different companies. I mean, I will promote and talk about products that I love, but not because companies pay me to, but because I really truly love them. And with that, I feel like I should be able to talk to you guys about what's new and what's coming down the pipeline, and not worry about, oh, I'm talking about this competitor and this company. And it's just very unbiased, real data, real information sharing, and real education that I just love sharing with you guys. So I hope you appreciate my authenticity. I hope I don't hurt anybody's feelings if I didn't mention someone or if I did mention something. But again, I love taking information from meetings like this where it's just concentrated, high caliber level of experts, and just taking from that meeting and sharing it with you and sharing it with someone, because I have so much excitement and so many things I want to share. Like, I can't talk to my kids about this or my friends about this because no one loves skincare and lasers and aesthetic medicine as I do, but you guys do. So we vibe on that, and I love sharing this information with you guys. So again, non-sponsored, not paid for, just truth and honesty, and basically being a liaison between an academic, very educational meeting and just kind of making it mainstream, so you guys don't have to wait 6 months and then read about it, you know, in Birdie or Pop Sugar or something. I'm just giving it to you straight and giving you the true and honest information, backed by science, backed by clinical research trials, and backed by colleagues who are experts in the field from amazing institutions all over the country and all over the world who've been using these products. So I hope this makes sense, you guys. Thanks so much for following, and thanks so much for your time and attention.